You are watching the DocTalk show.
So we want to further discuss more about the advantages of this vaccination in adults and what extra messages you can learn with regards to hepatitis B in preventing yourself from getting hepatitis B. Dr. Jackson,
Yes.
we have sensitized people about the importance of vaccination in adults. Could there be other ways to prevent someone from getting hepatitis B apart from the vaccination?
Yeah, Darius, we talked about the route of transmission. That's a fast prevention. We say avoid touching blood or fluid of somebody who's infected. Avoid having multiple sexual partners, the children who are playing. Those are the basic prevention that you can begin with. But the vaccination are now the second line, that the children, they should receive the routine vaccination, and for this case, the pentavalent vaccine, which you said very well, at age 6 weeks, 10 weeks, and 14 weeks, we would have finished. And we ask the mothers, the population, to ensure that the children who are born are vaccinated. The second one is what we are talking about, that the adults and adolescents, they still have the second chance. If you did not get the vaccination and you are tested and you are negative, you still have that second chance. That you go, they screen you. Once you have been screened, then you go for the vaccination. And you also 3 doses. On day 0, like today, and then the second, that will be the first dose. Then exactly 30 days after the first vaccination, you get your second dose. And then 6 months after the first vaccination, you get
the third
dose. And when you have done that, we expect that you have got the protection that you need so that you live without having hepatitis B.
And it's very important for people to complete this vaccination.
It's very important because when you start and you stop, you have not done anything. And as I mentioned at the beginning, that because we don't have enough money, the government has approved that we do it in a phased manner. So this year, we are in this financial year, we're in the Bugisu region. In the next financial year, we shall move to another part of the country. And we think if we do that, we shall cover the rest of the country within a record time.
So as the government does these community vaccinations, where do the people access the services?
Yeah, in all along when we are doing this, the vaccine has to be kept in a fridge. So we have advised the districts, because this is not like a program that comes from the Ministry of Health. It's done by the district. So the district are the one responsible for doing this work. The Ministry of Health, they plan for it, they make sure that the money is available. The money for the vaccine and the test kit, they go straight to National Medical Store. So it is National Medical Store that distributive in these vaccines and the test kits to the districts. It is not the Ministry of Health now.
So the districts organize
the district is now the one to organize the campaign.
Okay.
So the Ministry of Health do the work of training the people in terms of the testing, in terms of the treating the people who may be positive, and sensitizing the people. And that they do it together with the district health workers.
Okay.
Yes.
So thank you very much, Dr. Mone, for sensitizing us on this important topic of vaccinating against hepatitis B. The most important message, I think, to emphasize is prevention. Prevention is always much better than cure.
Prevention is better than cure, as they say. And then I want to add that we begin giving this hepatitis B vaccine for the adults and adolescents from Health Center 3, which from Health Center 3, Health Center 4, general hospitals, regional hospitals. So when you go in the areas where we are doing our operation or our activities, you go to those centers, you will get the vaccination free of charge.
Thank you again for watching the DocTalk show. I don't know if you have some concluding
Yeah, I
remarks.
want just to give some challenges that we met, because it will be very helpful for the population to know what challenges we have been meeting. That one, as we do our work, we have not been able to cover effectively the areas where we have gone through. One, people start vaccination and they don't complete.
They don't complete the 3 doses.
Two, there are some people who don't even come because they shun the vaccination. So it has been so difficult. And then the third one is the misconception. Some people, they don't believe in this vaccination. And because of that, you'll find people who are discordant. The husband is positive, the wife is negative. There has been a lot of problem in their families. And some people it has led to some people committing suicide, which we think by coming to the health facilities, those couples which one is positive and one is negative can really be explained very well how that can happen and how they can live together. And then the other thing which I want to talk about is we want to appeal to our leadership, political leadership, the other leaders in the district, to tell the population, to sensitize the population about the importance of this vaccine. Because if people come, within 1 year we could have finished one region so that we move to another region. But you'll find we may spend about two years in one region because people are coming in piecemeal, very slow movement, and that has really slowed down
The
our
community
activity. The community sensitization
aspect good enough.
has not gone so far. So as we move, we need to move with the population. So if we move with the population, that would be okay. One last thing which I want to say is we may have patients who have co-infection. They have HIV and they have hepatitis B. These people are already benefiting. Once they find that you have both infections, they benefit from one side. They go and get the hepatitis treatment from the HIV clinic. They don't need to get treatment from there and they come to the hepatitis clinic. So they get treatment from only one place. There are drug regimen which can treat both hepatitis B and HIV. So the people who come to the hepatitis B clinic are the people who have mono-infection. But also the good thing now, the world is trying to streamline that hepatitis B and HIV should be handled under one roof. I think that is the last statement which I want to make on this discussion about hepatitis B infection in Uganda. Thank you so much for inviting me
Dr.
from Ministry of Health to put our position clear on this issue. Thank you.
Thank you very much. And remember, you can always send in your questions and comments on our social media platforms. If you have enjoyed this show, you can also subscribe on our YouTube page and continue watching and sending in your feedback and discussions regarding hepatitis B. The key message is hepatitis B is preventable with the vaccine and with behavior change. If you're hepatitis B negative, go and complete your 3 shots of the vaccine to guarantee your protection against the illness. If you are hepatitis B positive, you go to your nearest health center, that's the treatment center for hepatitis B, and you will be guided through the treatment steps by a team of health workers. So we'll see you again on the DocTalk show next time. Enjoy your day.
You are watching the DocTalk show. Insights from a malaria specialist, Dr. Maya Lugemoa.
My name's and I'm a malariologist. Of course, it manifests with a lot of symptoms, but fever is the main cardinal symptom. Fever is the main complaint of any patient, but there are other associated symptoms like headache, joint pains, loss of appetite, diarrhea, vomiting, and to some extremes, and especially in children, convulsions, loss of consciousness, sometimes delusions, and so many other manifestations.
You are watching the DocTalk Show. The DocTalk